What you're about to see will shock you. This is a Mail Today expose. Doctors in Delhi claiming they can cure homosexuality. These dubious doctors have been caught on camera saying homosexuality is a mental disorder and it can be corrected with medical treatment.
This is actually neuropsychiatric disorder.
Okay, it's a disorder.
Schizophrenia. नाम सुना bipolar disorder. ये सब है. जो पेशेंट ठीक होते हैं पूरे ठीक हो जाते हैं.
Reputed Delhi doctors, homosexuality is a mental illness, much like schizophrenia and hysteria, that can be treated for a fee. These are no small fly-by-night operators or shady clinics tucked away in congested localities. Safe Hands Clinic in Delhi's posh Safdarjung enclave, Super Speciality Clinic in Karol Bagh, Radha Polyclinic in Mahipalpur, and reputed doctors armed with the right medical degrees. It's the big Mail Today expose. Our reporters visited these doctors for gay cures and they were quick to oblige, prescribing nausea-inducing drugs, testosterone or even talk therapy. This despite medical experts and studies reiterating that there is absolutely no scientific merit to any gay cure treatment. A doctor in Delhi's Mahipalpur doesn't even wait to examine the patient, prescribing a medication for mental disorder immediately, a pill that can have fatal side effects.
ऑनलाइन है ये 5 mg HS देता है रात में सोते समय है मेनिया है आप लोग सुनो तो हिस्टीरिया
हाँ
ये सब न्यूरोसाइकियाट्रिक डिसऑर्डर है.
अच्छा इस ऐसे तरफ ये भी एक डिसऑर्डर
इस तरीके से यह भी एक डिसऑर्डर है. दवा शुरू करो इफेक्ट हम टाइम पर देखेंगे क्या देता है.
These doctors claim that curing homosexuality is merely about balancing the male and female hormones. The treatment has a price and a timeline.
We put them on proper medication. Definitely after 3 to 4 months of taking medication, the patient is improving, the symptoms are improving. And I had seen number of patients who were total homosexual guys marrying and having children.
Another doctor openly calling it a mental disorder resulting from child abuse.
First the thing is हमें पेशेंट की ना डिटेल्स चाहिए. क्या एज है, मैरिड है, अनमैरिड?
नहीं मैरिड नहीं है.
ऐसा लगता है कि बचपन में कुछ ऐसा हुआ?
नहीं ऐसा हमारे नॉलेज में ऐसा कुछ नहीं है.
45 मिनट्स का सेशन रहता है काउंसलिंग का.
When confronted with proof of the investigation, some doctors tried to brazen it out.
We don't use any psychiatric drugs. We put patient on a normal medication. That is simple medication which will improve his lifestyle, which will improve his hormonal imbalance and which will improve his carbohydrates, minerals, proteins.
Others shied away from a response.
Right in front of Delhi's Karol Bagh metro station, gate number 2 and 3 is located this super speciality clinic. Dr. P.K. Gupta is a senior consulting sexologist. Now, Dr. P.K. Gupta's advertisements are really splashed all across the web, and according to Dr. Gupta, homosexuality is really a genetic and a mental disorder.
The idea that gay people can be cured is certainly not new, but these doctors peddling such cures are only selling myths. Myths that may result in terrifying side effects. With Sangeet Sebastian, Bureau Report, India Today.
So this gay cure racket in Delhi, the question we are asking, should licenses of doctors promising gay cure be revoked? Call us, tell us your views. 0120 480 7310 is our number. I want to begin by bringing in my colleague Sangeet Sebastian of the Mail Today group. Sangeet did this expose. He joins me on the broadcast. Welcome, Sangeet. I also want to bring in Amit Khemka, who's a lawyer. He deals with these issues and several others on the legal position here. Now, Sangeet, you went to some of these doctors and they actually promised that they can cure somebody being gay by giving them hormones, by giving them the right kind of proteins and carbohydrates.
Yeah.
I mean, that is quite shocking and unbelievable. When we started this, the whole story, we were completely unsure that, doctors will actually do that.
And these are MBBS doctors.
MBBS qualified doctors, MD, with all the relevant qualification. And, when we called them up over the phone, some of the doctors outrightly rejected, saying that, you can't treat homosexuality. It's not a disease or a disorder. You go somewhere else. And we couldn't do, then that is when we tried other numbers, and there was doctors who were saying, you come, it's 100% curable. We fixed an appointment, went there, and we were really appalled by the kind of things which they were saying.
This clearly is appalling, but for the benefit of our viewers who are just joining us, what is it that these doctors said? What is their diagnosis? How do they cure homosexuality?
See, they have this practice, it's an umbrella term called conversion therapy. Conversion therapy, it's a series of dubious practices, which beginning from talk therapy, and then going to reorientation and all that.
Okay.
So it's completely, there is no absolute scientific evidence to show that it works.
Okay. Now, is it even possible, Mr. Khemka, you've dealt with transgenders, you've dealt with this case of, gays and lesbians, doctors who are claiming that they can cure them. Can legal action be taken against such doctors?
Gaurav, the first question would be, why cure them? Is it some kind of an illness that you are curing it? Question of curing would only be there once this is an illness. And the society, the scientists, sociologists, everybody is in unison that it is just the choice of a person. It is just his disposition towards it. So it is not. It cannot be termed as illness. Number one.
Okay.
Number two, when there is no scientific evidence of it having worked, it is certainly misconduct.
Yes.
By these professionals.
And this is professional misconduct.
Absolutely professional.
Penal action can be taken, legal action can be taken.
Penal action should be taken.
This is a case under Section 420 of the IPC. This is cheating.
The only thing is that the Supreme Court says that there has to be a committee made for it, and only an expert committee will give a ruling on that.
Okay.
So
now,
that
Sangeet, you had interacted with some of these so-called patients, people taking their children, and in one case there was this instance of somebody who wanted to get married and the parents perhaps are forcing them. Describe to us the trauma that these so-called patients undergo at these hospitals.
See, there was this boy, he's a final year student at DU, I can't reveal his name obviously.
Of course.
Yeah. So he was telling me about this story about how he was actually forced by his family to go and meet this psychiatrist, and this psychiatrist promised him that he will turn him into a heterosexual and he will be able to lead a happy life, within quotes. So that, and he was subjected to,
shock treatment.
Electric shock and
were given to a youngster, a BA honors, a BA student.
Masters. And first it begins in a very milder version, like, he was asked to sit in a chair, then his fingertips were attached to electrodes, and then, the electric shock will come. And after administering the electric shock, every time he will be shown images of nude men to induce some kind of aversion in him. So once that didn't work, then the doctor sedated him, put him on a bed and attached the electrodes on his skull and started administering shock. And in a span of 3 months, this boy was given 21 electric shocks.
He must be a wreck.
He was completely traumatized, and and he had constant nausea and he missed his viva. He delayed his. He had to completely skip his masters, and his certificate got delayed by 1 year, and he's completely disgusted with his family now. And even though to his family he is completely normal, he says that I am gay and I will remain gay.
And he said that. So no cure works. Let me bring in a viewer of ours. Krishna calls us from Vishakhapatnam. Krishna, you're listening to what's happening here. What action, according to you, needs to be taken in such cases, Krishna?
Yeah. See, I think the very concept of the entire grouping of patients who are studied MBBS and MD-DOS is like, I think it's the most biggest crime that they are doing.
Yes.
Educated people like those, they can do people stating that, these kind of things can actually be cured. I don't know where does India is going ahead.
That's a fair point you're making. That's a fair point you're making. Stay with me for a moment, Krishna. Amit Khemka, in a situation like this, can legal action under Section 420 of the Indian Penal Code be registered against such doctors?
See, the Supreme Court has saved these medical professionals by giving a judgment that whenever there is a criminal case to be registered against medical professionals, so there has to be a medical board constituted first.
Yes.
And that medical board has to give that opinion. Once that is there, then it can be done. But Gaurav, the bigger question which comes to my mind here is that why was this young man actually choosing to go to these people? Were there any social pressures on him? Were there parental pressures on him? Was he doing it on his own? I mean, it's horrifying that if a society, whatever doctors are doing, I mean, it's obviously condemnable. But if there were family pressures on this man, then it is all the more condemnable that the family is choosing that their own son or their own child goes through this horrible trauma.
For the benefit of our viewers who want to join us, our numbers are being put out. They're being flashed on your television screen. Call us, join us in this question, in this debate. Should licenses of doctors who promise to cure gays, should their licenses be revoked? 0120-480-7310 is our number on your television screen. Sangeet, why was this youngster you spoke to, why was he compelled to go? Why did he go to such a doctor?
There was a brief incident which happened before he was taken to the psychiatrist. He went on a picnic at his, as a part of his study tour, and there he had a boy in his class whom he had strong feelings for.
Okay.
And in the course of the picnic, they got drunk, they shared the same room, and he get into an intimate relationship, relation with him. And this particular boy, he goes back to his family and shames him in front of the entire family members and humiliates him. Right. So that is how this guy gets outed, that he is a gay, and there is something wrong with him, and it has to be treated.
That is family pressure.
Then family pressure. This boy's sister is was a psychiatrist, so she knew somebody who is a specialist in this, and she took this boy to the psychiatrist saying that, doctor, please help him.
And doctors like this, they operate openly with their big boards that say that we can cure gays.
They treat them. I mean, in fact, when we talked over the phone to some of the psychiatrists, the interesting response in return which they asked was that, you treat, I mean, this blood pressure and diabetes is not completely curable, but we still treat them. So
okay, Shamim joins us from Shillong. Shamim, tell us your views, share your opinion with us.
Yeah, sure. I just wanted to let you know what I think about revoking the licenses of medical practitioners, as you are saying on your question. I don't think that should be done, because doctors are there for treating patients. If you think you are a patient and you go to a doctor, doctor will never deny you treatment.
Okay.
Okay. Any doctor denying treatment should, their licenses should be cancelled.
But isn't this cheating? Before I come to you for more on that, I also want to bring in Harish from Bangalore. Harish, tell us, in your opinion, should licenses of such doctors who promise they can cure gays, should their licenses be revoked? We'll get to Harish in a bit, but is there merit in what Shamim was saying, that it's a doctor's job to cure whatever he may think can be cured?
Absolutely not. His first job is to advise whether it is actually some kind of a illness, whether it is some kind of a disorder, then only he will cure. So when it is not a disorder,
right,
and if he is curing something which does not exist, then it has to be a misconduct.
And that is why, isn't this then a case of cheating? Because it's been established that being gay or lesbian is not a disease, is not an illness. So in such a situation, if doctors say that we can cure you, is this then not a case of cheating, Mr. Khemka?
Absolutely, he is misleading the person. He is gullible, so he is taking benefit of his gullibility. He knows that he is vulnerable. That is why he is taking benefit of that vulnerability, and he is misleading this person. He is actually telling him, while he is not sick, he is not ill, he is perfectly well. It is only a question that whatever may be his sexual preferences. So that is all.
Is this restricted to just one doctor in Delhi, or did you come across similar cases in many places?
We came across a couple of doctors who actually said that this is a treatable, completely curable disorder or disease. So we have, but at the same time we also got to hear from doctors who said that this is not treatable, this is not a a disorder or a genetic disorder or a mental or a disease to be addressed. So there are it's only a section of doctors who are indulged.
Sangeet, were they giving prescriptions? Were they writing that this is your problem? Were they giving something in writing to these people?
Yeah, in fact, in one particular clinic where we went, this doctor, because we went there posing as relatives of a gay individual who required treatment. So this doctor, after listening to us, he said, okay, this is a case of neuropsychiatric disorder.
Yes.
Okay. And he prescribed us this tablet called Olene's 5 mg.
And there's been an instant reaction to this expose. This is an India Today impact story taking cognizance of a report on some doctors in Delhi brazenly peddling gay cure therapies. Delhi's health minister Satyendra Jain has said that they will take action against such doctors. There will be an investigation. Let's listen in to what Satyendra Jain, Delhi's health minister, is saying.
अगर ऐसा कोई नॉन स्टैंडर्डाइज इलाज कोई कर रहा है तो उसके खिलाफ हम कोई एक्शन करेंगे, कार्रवाई करेंगे। लेकिन ऐसा जितने हमारे अधिकार हैं बिल्कुल करेंगे। ज़्यादातर अधिकार दिल्ली मेडिकल काउंसिल, इंडियन मेडिकल काउंसिल के पास है, उनको भी लिखेंगे और हम जो भी कर सकते हैं हम तुरंत उसको करेंगे।
So action will be taken. There will be an investigation, Mr. Khemka. This is the best way forward. Delhi's health minister says if such doctors are operating, action will be taken.
He himself is a doctor. The first question to him should have been that do you think it is a disorder? So, but anyway, I don't think the government will have much to do in it, because police is not with them and the medical council is not with them.
Yes.
So it is the medical council which will have to take action, one, and second is it would be the Delhi police which will have to take action on it.
I will come to you for whether the medical council reacted to your report and what action can they take in such a case. But Chandrasekhar joins us from Hyderabad. Chandrasekhar, tell us your views on such doctors.
Sir, I'm a medical student from Hyderabad.
Okay.
And I observed what the difference between the US practice and Indian practice is. We don't have any reporting system. Whereas in other Western countries, the reporting has to be done. What medication is given, what medication has caused the adverse effect.
Yes.
And whereas in India, that is not in practice. We are 75 years lagging behind other nations in terms of medical practice.
That's a fair point you're making. If they're giving wrong prescription drugs.
That's exactly what I said.
Yes.
That what they do is that they don't put it on record. That is why I asked Sangeet that are they giving it in writing? They don't.
No.
They will just prescribe the medicine, but they won't write that what
this medicine is for.
And what is it which they are treating. They will not write that.
Okay, very interesting. But this is an investigation that Sangeet Sebastian and his team will be taking forward, and we will be tracking the story very closely. Amit Khemka and Sangeet Sebastian, for the moment, many thanks for joining me. A quick break. There's lots more lined up on the other side of this break. Top stories, headlines. We'll be back. Keep watching.